She graduated UTSA and ended up graduating with her master's at UT Houston,
Health,
correct?
yeah.
Yeah, UT Health Houston. And yeah, I know she still got plans to go on, but like, how was that process of going through college and everything like that? Like,
Um, Honestly, when people like, whenever I was younger, people say like, "Oh, college is what saved my life." I'd be like, "That's so freaking lame." But now that I'm like, how many years post grad, college is really one of the best years of your life. Like, just being close to your friends, having like that cushion of being in school. You don't have any real responsibilities outside of school. And maybe like work. It was a good time. Like, I'm friends with a lot of people that I met at UTSA still. So
hmm
and then when I was graduate, so senior year of undergrad, I got into a 4+1 program where it's like basically you start your master's your senior year of undergrad, and then you finish. You just do like one additional year of like your master's. So instead of like 6 years, it'll take 5 years. So I got into that by the grace of God. But then COVID hit, so I didn't have a graduation. I was getting ready to go to Afro Nation, Puerto Rico, and then we thought it was gonna be like a little joke, like, "Oh, spring break's gonna be longer this year," but
No,
no, they
yeah,
canceled spring break, canceled graduation. I finished my senior year
graduating online.
virtually, and then I
Yeah,
continued my first year of my master's. So my whole master's degree was basically virtual during a pandemic, which is kind of ironic because I was in public health, but it was cool. I was in San Antonio. Most of my friends had left the city or graduated or just like, relocated because it was COVID.
yeah.
So just
Living in San
me doing
Antonio
school
was a
virtual like for
crisis.
4 hours a day. And then I was also a case investigator. So I would like call people that have COVID and, do all that kind of stuff. And so
Can
like,
you actually, before you go past that, can you go down to the case investigator? What
I
do
mean,
you
there's not
do?
much detail about it. I just basically find people who have COVID, ask them, where have you been? Who have you been around? Just kind of like track
Or
their
you're
movements.
that first call?
Yeah. So I'm just trying to like, to see if they need to be quarantined, if they got anywhere, to see if we had to contact anyone else. So it wasn't really, I mean, it wasn't nothing much to it. It just, I think it was more COVID tracking, COVID tracing that I was doing actually. I don't know what
hmm
it's called, but basically that's all I was doing during school. So school was nice. I really liked my master's degree. I was debating if I wanted to go public health or the medicine route, but then I decided public health because I felt I wasn't committed enough to go to school forever and have the kind of life balance that surgeons usually have. So yeah, I went public health route. I really liked my degree. I really do like my degree. I plan to get my PhD in public health. And yeah,